I'm Dr. Jeffrey Schels with Advanced Chiropractic, and today I wanted to go over the pattern that we see of as people get older and they start to lose health and lose functioning and eventually have symptoms, and how with chiropractic care we're able to not only get people out of pain but to improve the functioning and improve their health so they can live the life they were created to have. So as I demonstrate that, when we look at this graph here, the y-axis here is health. So the higher up, the healthier the person is. And this is over a period of time. So most people start off when they are younger with good health. But what happens because of the normal everyday stressors in our lives, whether they are physical stressors like playing sports when we're a kid, playing video games, looking down like this, having car crashes, or even whenever we're at work at a computer all day or lifting or doing those kind of things. Those are physical stresses. There's also emotional stresses. There's also chemical stresses related to diet and things that we face in the environment. But because of all those stresses combining, people over a period of time start to lose health and they start to lose functioning. And as they do that, eventually, if they lose enough health and functioning, they cross the pain line. And this is where the symptoms begin. See, a lot of people think that the symptoms start the first time they start to lose health. But the reality is symptoms don't even begin until you already lost a lot of health for the majority of health conditions. And so at that point, this is where a lot of people will start to either take medications or go to the doctor, start to take drugs, prescriptions, maybe surgeries. But when we find folks and they're in this area here where they're having symptoms, the very first thing and the most important thing that you can do is to identify what's causing the symptoms. Because a lot of times for the conditions we see here, like, most common conditions are back pain, neck pain, and headaches and those kind of things. If a person's taking medication, the vast majority of the time, the medication isn't really addressing the underlying problem. As a matter of fact, I can say that it's never addressing the underlying problem. It's just masking the symptoms. So what we do is identify exactly what's causing the symptoms and then come up with a plan on how to, number one, get the person feeling better, but even more importantly, correct the problem so that not only can we get them out of pain, but we can fix the problem so that they can actually improve their health over time. See, the normal pattern is people slowly become less healthy, they have more symptoms, they're on more medication as they get older. So by the time they get later in life, they have to use walkers or wheelchairs, or their whole week revolves around their doctor's appointments and their pills they're taking. But what we like to do for folks is get them out of pain and get their bodies functioning to the highest level that they can. And there's always an individual variation on how much health a person can achieve, but we want to get folks functioning as good as they can be personally so they can live the life they were created to have, with energy and vitality and not having to live on drugs. So now up here, that person is a blessing for their family. Down here, unfortunately, a lot of times people can become a burden for their family, but we want to avoid that, right? We want to help people as much as possible. So if you are already to the point to where you're having symptoms and you'd like to find out, number one, what's causing the symptom, and number two, if there is the potential for a non-drug, non-surgical approach to fixing that problem, then give us a call. We'd love to help you if we can. Our number is 254-778-2225. Thanks, have a great day.